All right, we are recording. For those able to start joining, good afternoon or good morning, depending on where you are joining us from. I am Alex Valancourt. I am the CIO with the Health Collaborative here in Cincinnati, Ohio, and one of the HIMSS, CSO HIMSS board members. And today I get the pleasure of introducing you to today's session. COVID-19 may have just saved U.S. healthcare. And I got to tell you, from the work that I see my organization involved in, I full-heartedly agree to this. So I'm interested to hear what our guests have to say. But before we start, let me just, if Richard, if you can go to the next slide. First of all, for those of our attendees, I want to thank our board members. You see listed here, we have a very active board with the CSO HIMSS. So I want to thank everybody who's able to join from our board members and all their hard work and try to help move our actual conference, our real conference, our in-person conference to a virtual conference, which is no small feat. So thank you, board members, for your ability to do that. I also want to thank all of our attendees for joining today. So thank you guys all for joining, taking time out of your day. We tried to keep our virtual conference to short half-hour sessions to allow you to have time in your day to join, get some information, tidbits useful for your careers and your opportunities with your organizations. So hopefully this is a worthwhile session as we continue these. I also want to take just a minute to thank our sponsors. You know, even though we've gone to a virtual conference, it still takes time, energy, and money to put on virtual conferences. And even those while we had mobilized toward a in-person conference, and some of that, the funding was not able to be recouped. So thank you guys very much for our partner sponsors. What you see on the slide here are some of our partner sponsors, our elite sponsors. Great group there. More of our elite sponsors, our premier sponsors as well. Thank you guys very much. And our platinum sponsors with Protenus, CBTS, and Cisco. Been fantastic to have an active community with CSO HIMSS of all of our sponsors. So thank you guys very much. And with that, I want to start us into introducing you guys to our guest speakers today. We have Richard Stainings, who is also hosting the slides for today's conference. For us, he is the Chief Security Strategist from Solera out of Boulder, Colorado, a company, I think, out of New York City, if I remember right. And also want to introduce you to Michael Archuleta, who is the Chief Information Officer with Mount St. Raphael Hospital in Trinidad, Colorado. And just a couple quick items on logistics. Today is only a half-hour session. We have a very jam-packed agenda. So what we will try to do, all attendees are on mute so that we avoid any background noise, and we will open that up for Q&A. However, there is a chat section within WebEx, and if you would like questions as you think of them, please feel free to use that, and we'll try to answer as we go, and then we will open this up at the end for formal Q&A. So with that, can I turn this over to Richard and Michael? Thank you guys for joining us this morning.
Great. Thank you very much, Alex and AJ and everyone else at CSO HIMSS for inviting us to come along and present this session today. This is Richard Stainings. Many of you will know me from my role at the International HIMSS Cybersecurity Committee over the years and various other roles. Mike, say a few words.
Hey guys, thank you very much. Really a pleasure to be here today, really speaking in regards to this overall COVID-19 issue. But first of all, I would really like to thank all our doctors, nurses, and medical staff, and all our frontline employees keeping our community safe. And I'd also like to thank the unseen workers for all their dedication in keeping our organizations running. So thank you guys very much for all that you do.
Great, thanks very much. Well, we've got a fairly short session here this morning, and Mike and I have pulled together quite a few thoughts and some research that we wanted to share with the broader CSO HIMSS community and the healthcare industry in general. So let me get started. We are going to pile through this fairly quickly. So as Alex said, if you can save your questions to the end, We're happy to go through those or to take those after the call. So I want to start with a Chinese phrase here called Wei Ji. If I pronounce that correctly, apologies to anyone whose Mandarin is significantly better than mine. But it's the Chinese word or combination of characters that combines danger and opportunity. It also stands for crisis, right? And there's a good argument to suggest that never miss a good crisis, right? There's never let a good crisis go to waste. And I think COVID-19 has presented us with some major challenges, not just from the crisis of keeping people alive and dealing with a global pandemic and all of the other things that have kept us so busy since, well, probably January, February timeframe across the United States, and before that outside of the US. But I think it's given us an opportunity to think outside of the box and to reevaluate the way that we provide healthcare services to the population. We have a challenge in healthcare that has existed for quite some time: rising delivery costs, declining revenues, and an unequal access to healthcare services that I think COVID has brought to bear. And I want to talk about some of those things. The net is we need to get a lot smarter how we deliver medical services to our population, whether it's in pandemic or whether it's outside of pandemic. In the US, we've had a broken healthcare system for quite some time. It's a legacy system that has persisted since the post-war era, and it has expanded kind of ad hoc in order to provide the types of services that we have today. Admittedly, we have some of the best healthcare services in the world. Unfortunately, that doesn't necessarily translate to some of the best healthcare statistics in the world, particularly when it comes to public health or population health, which of course are very concerning and front and center in our discussions around COVID, right? Today, chronic disease in the United States accounts for approximately 75% of the nation's aggregate healthcare spending. So 75% of the money that we spend are on chronic diseases that, by and large, could be avoided. Let me share a few statistics with you first. We're all aware of the exorbitant rates of US healthcare costs and how that is sucking the life out of our GDP as a nation. We have the highest percentage of GDP spent on healthcare of any nation in the world. Our costs are widely considered to be out of control. And we have a crisis, a looming crisis, with a silver tsunami of baby boomers retiring and hitting Medicare over the next few years. That's already being expressed in a spike in government-funded healthcare patients in our hospitals, and also in a spike in terms of the reduced remuneration that hospitals are receiving as a result of a larger percentage of Medicare and also Medicaid patients, thanks to the expansion of Medicare and unequal access. The US spends twice per capita of other countries on healthcare, with some rather interesting results. If we look at infant mortality rates, the United States is, up there above Chile and various other countries in the world, right? Our maternal mortality rates in the state of Texas are some of the highest in the world, and yet we spend so much money on healthcare, it's hard to believe. A lot of these statistics, and I've got a lot more slides I could have shared with you. I'm freely happy to make this all available to you for anyone that wants to research into it. We in the US tend to treat the symptom rather than the cause, and I think the COVID epidemic that we're dealing with today is a fine example of that. We've developed some of the world's best invasive medical procedures to fix all kinds of chronic illnesses, but that comes at a cost. Our pharmaceutical prices are widely considered to be out of control, to the extent that many people in the country, particularly if you live near the Mexican or Canadian borders, will hop across the border in order to fill up their prescription rather than purchase it from the local pharmacy. Yet we spend very little money on prevention or public health compared to other countries. And I think the slide in front of you with the polio iron lungs during the poliomyelitis outbreak before widespread vaccination was available is a fine example of how treating the symptom rather than the cause has persisted, since the 1940s and 50s and early 60s to some degree. through to the present moment. We need to build a public health system in order to improve our health system over the entire country. As I mentioned, chronic disease sucks up most of the money that we put into Medicare, 96 cents in the dollar, and 83 cents in the dollar in Medicaid. 45% of Americans suffer from at least one chronic disease. And as we get older, so we end up getting into more and more chronic diseases, thanks to our largely unhealthy lifestyles here. And 1 in 4 Americans suffer from multiple chronic conditions, MCC, which obviously becomes even more expensive to treat. As I mentioned earlier, the Silver Tsunami is approaching us. We have a retiring population, an aging population. Older people tend to consume more medical services than younger people do. It's common fact, right? That's why so many 20-year-olds have neglected to purchase health insurance, because they rarely use any services. Most elderly people will be on some form of Medicare, even the poor ones eventually that don't have health insurance today. Poor people have more chronic disease, so we may need to spend more money on Medicaid today in order to increase healthcare access for those individuals, in order to save money on Medicare tomorrow, right? Public health is an economic utility. There is an advantage to me as an medically insured individual for the person sat next to me on the subway train to be healthy. There is an economic utility to that person and everyone around me being healthy, because they're not going to pass on diseases to me and make my life unpleasant as a result of that. And obviously with COVID, that can be quite lead to some quite unpleasantness. And I want to talk next, or at least I want Mike to talk next, about some of the cost shifting that we're seeing in our healthcare system and how that is impacting or potentially impacting the future of healthcare in the US. Mike.
Yeah, absolutely. So thank you very much, Richard. So the cost shifting definitely is no longer an actual option. Shifting cost to patient covered by insurances become less effective, and basically as we know it. But the thing is the reason why we're here, ladies and gentlemen, is we discuss and we ask ourselves, what is a hospital? What is a clinic? We are digital companies that happen to deliver healthcare services. The acceleration of digital transformation is here. We need tech and big tech now more than ever. This is the new norm as we see it now. Life as we know it is no longer going to be the same. And honestly, looking at this massive transformation of how do we deliver care more effectively, efficiently, more securely. I mean, when we look at this overall COVID-19 pandemic, we truly see that the mass adoption of telecommunicating has been the most explosive change to occur during the coronavirus pandemic. And what I always love to say too is hospitals, clinics are digital companies that happen to deliver healthcare services. And this crisis has fully displayed the value of IT and digital transformation. If we could go to the next slide, please, Richard. Yep. And then the king in his castle. Why do we still expect sick elderly patients to drag themselves into the city center during winter weathers to see a doctor? When they have to wait hours and hours. Why don't we basically, as an industry, continue to innovate and utilize technology to basically improve better efficiencies? And this is the bottom line, ladies and gentlemen, is honestly seeing this overall pandemic. It has really shown organizations the true importance that IT brings and digital transformation basically brings to the organization. Because like I always like saying is, we have to focus on digital transformation, and we have to truly incorporate IT as a core component to the organizational strategy. Because in the end, when we're looking at all these different initiatives, how do we flatten the curve? How do we basically provide better ways of communicating with patients? Again, we're seeing the massive adoption of telecommunicating. We're seeing employees working from home. We're seeing all these new relaxed enforcement activities that the Office of Civil Rights under HHS has really relaxed towards telecommunicating applications due to this overall COVID-19 pandemic. But the thing is, as well, we as an organization have to continue to make sure we are fully responsible and accountable for the activities and the technologies that we're basically implementing. Moving forward, telehealth and telemedicine is truly the future. Physicians can really see 4 times as many patients via telehealth consults than any, in person. And the cost per patient consults are less than half than an actual office visits. And in my opinion, telehealth really boosts the overall patient satisfaction scores because this is a way we can bring technology to the patient, to the individual's home, and basically do what we need to do to continue to provide better care moving forward. If we could go to the next slide, please, Richard. AI, ML, and automation, that's a critical element. Artificial intelligence, I really think we're going to start seeing a massive adoption towards that even more now. Automation is such a critical element too. We're starting to see that this COVID-19 has really put a detrimental revenue issue towards all these healthcare organizations. And we're starting to see now the staff reducing and reducing. I read an article showing that there's going to be an IT pandemic. How do we basically do more with less and focusing on better ways to basically automate our overall process, which really improve on patient longevity, which is such a critical element. Next slide, please. And then the healthcare. Healthcare, Internet of Things. This is such a critical element, ladies and gentlemen. Healthcare IT workers are continuing to struggle to secure the Internet of Things devices during this COVID-19 pandemic. And what I saw a statistic out there that's basically stated that 83% of healthcare systems are running on outdated software and unsupported operating systems such as Windows 7, which as we know it, truly leaves device vulnerable to hackers, and this becomes an actual problem. And today, 16% of imaging systems are at a 51% risk of getting hacked. And there is 26% chance that 14% of patient monitoring tools will get attacked. And that 27% of medical devices are still running Windows XP or decommissioned versions of Linux OS. And the number of stolen medical records has truly increased by 65%, which is truly impacting around 40 million Americans. The thing is, ladies and gentlemen, we're starting to see that we are truly living in the digital age of healthcare. Cybersecurity has to be an important factor moving forward with anything that we do. And at times, especially during this specific items, I always like saying that cybersecurity isn't just about data security. It's also a matter of life and death. We always, as an organization, need to continue to focus on our people, process, and technology, change the culture, improve the way we're basically focusing on patient care, bring innovative technology advancements to the industry, because it is such a disservice at times that we basically see the healthcare industry many years behind any other industry, like the natural gas industry, like the banking industry. But ladies and gentlemen, we are taking care of patients' lives. That is a major and top priority, the number one top priority. And at the end of the day, I always like to say that I have a new CEO, and my new CEO is the patient. And that's basically the bottom line. As an organization, if we do not continue to basically focus and bring innovative ideas, telehealth, innovation, asynchronous tools that benefit our patients both inside and outside of our organizations, we will not be successful. And here's actually a good slide that shows the top 12 causes of death moving forward. Top 12. Look at software failure, ladies and gentlemen. That becomes an actual major issue too. System message installation. New updates have been installed on your heart valve and the main operating system. Your system will automatically reboot in 5 minutes. If you look at the pacemaker software alone, there was 6,000 security flaws associated with that. 6,000. So ladies and gentlemen, our overall focus, as I've stated, we as a healthcare industry need to start continuing to incorporate strong IT, cybersecurity, innovative initiatives as a core component to the overall organizational strategy moving forward. Because at the end of the day, COVID-19 has really displayed, were you ready or were you not ready? And then again, this crisis has truly displayed the value that IT and digital transformation basically bring in. And we're starting to see now a lot of these healthcare organizations are starting to truly intensify their focus on strategically planning for a digital future. And they're really preparing themselves to be ready to launch new initiatives when this crisis passes. And that's such a critical element because I truly believe that this unpredicted pandemic truly puts us in a position to be more progressive in bringing in innovative ideas and open to learning from it. If we could truly take the experiences gained from this unique challenge, we as an organization can continue to evolve our practices and continue to invest in digital transformation, which again, which basically all bring us to a better space moving forward. And some of those issues here, cybersecurity becomes the greatest patient security risk. As I stated, cybersecurity isn't just about data security, it's also a matter of life and death. We as an organization need to make sure we're taking top priority moving forward in regards to that. We're seeing a lot of these cybersecurity incidences that are basically happening. A big increase of ransomware attack, a big increase of you're starting to see a lot of phishing phishing going out via emails, individuals still getting click happy. That is still becoming a problem. And why do we continue to see that as well? Is because the overall culture of understanding of what cybersecurity truly is has not been a built foundation. And I always like to say, though, too, is when we're building a home, we build a strong foundation. If we put cheap material in it, it will crumble, it will break. We as an organization need to make sure that we are building a strong technological, innovative foundation that will allow us to basically react efficiently, effectively, securely moving forward if a new pandemic ever strikes. Because I always, at the end of the day, my number one thing is patient care is definitely number one. And we want to make sure that we continue to focus on those specific initiatives itself. Richard, any additional questions?
No, I'm going to open up to Alex for any questions and the audience to submit their questions. But I think you're spot on, Mike. I think IT is going to become even more important to healthcare than it has been in the past. IT and cybersecurity have often been viewed or perceived as being a cost center within healthcare delivery, an industry dominated by, let's face it, physicians and other clinicians in our system. And I think it's going to become critical, as you mentioned, right? But we need to make sure that we're using the best possible technologies in order to facilitate the digitalization of our industry, and at the same time make sure that those assets are secure. One of the biggest issues I see in healthcare is that the vast majority of hospitals have no idea what assets are connected to their network. And as we expand medical devices, which are growing internationally at 20% per annum, so that problem becomes bigger and bigger. If you don't know what assets you've got on your network, you can't understand the risks that they may present to your patients or to the availability and resiliency of your IT systems. One of the previous slide I put up there about Parkview Hospital, which is just down the road from both of us, Mike. Their EMR system was taken out by a ransomware attack a couple of weeks ago, and there's a blog article that I wrote on that for those of you who may have read it or would like to go back and view it. This is the criticality of an enhanced digital healthcare system. If we don't put the security pieces of the puzzle in place, then patients will suffer.
I agree with that, definitely, Richard. So organizations really need again, to have an accurate number of the Internet of Things devices that are truly connected to their network, which again will truly lead to a more well-rounded understanding of any associated risk and truly give a more wholesome perspective of the environment within their overall cybersecurity strategy. And then to add another comment to one of your points is, yes, IT is going to be a core center of the organizational strategy. Ladies and gentlemen, we need to take this concept away that IT is an actual cost center. We need to move away where IT is a profit center. That is the future. We are living in the digital age of healthcare. Clinics and hospitals are digital companies that happen to deliver healthcare services. This is a new norm. How are you truly going to react and change your overall process?
All right. So Richard and Mike, thank you guys so very much for the discussion today. This was great. I can also tell you from my own organization, we're seeing a lot more activity from cyber hacking, and even for the voicemail messages, the fake voicemail messages that are showing up in inboxes because of everybody working from home. So, but I do want to take just a minute. There are two questions that we have come in. One from Mitzi. With the growth of digitalization, how will healthcare IT infrastructures need to change to support this growth? And one of the two of you field that question, please.
Mike, do you want to take a first stab at that?
Yeah, absolutely. So again, the overall infrastructure is, how are you building your overall foundation moving forward? We're starting to see a lot more on cloud-based initiatives coming into the healthcare organizations. Have you really focused towards your organizations on virtualization? I mean, that's been a big aspect and a big success point for our organization, is we've had.
Did we lose you, Mike?
Yeah, I think so. It sounds like it.
Someone hacked his internet connection down there in Southern Colorado. I'll continue if you like. I think Mike raised a good point. Oh, Mike, you're back again. Okay, you dropped out there a second. He's dropped out again. All right. So I think Mike raised a good point there about cloud adoption. Particularly, one of the things that concerns me is around hybrid cloud. A lot of hospital systems have not adopted a single cloud service provider, and they haven't looked at an overall, cloud gateway or cloud security strategy in order to secure this spreading of medical information, both internal and external information, across the internet. And I think this is probably one of the things that healthcare organizations need to look at much more carefully, right? Is developing a strategy for IT for the future. And let's face it, making sure that IT is funded correctly. We tend to get the scraps in healthcare. Money tends to go towards a new bricks and mortar outpatient clinic before it comes to replace, 10-year-old servers in the data center. And we need to change that. IT is going to be the core of our healthcare delivery moving forward. And those in charge of our hospitals need to come to that recognition. As more services are delivered digitally, so bricks and mortar buildings become almost irrelevant. So we need to adjust our flows on that and make sure that we have adequate strategies.
So let me ask another question that we have. Thank you for that. Another question similarly, along a similar thread. With the change in digital health, do you see an internet or network bandwidth issue, and what changes might be needed?
I'll start with that one, Mike, if you like. Yes, I see that as being a potential issue. I think, there has been a gradual expansion from what I've seen of all the hospital systems I've worked in over the years of bandwidth to hospitals as we move towards more cloud-based services. So that bandwidth leaving the hospital becomes ever more critical, but so does the resiliency and the availability of that bandwidth. If I'm a hospital provider in a community, I want multiple redundant paths to my cloud. And I want to look at things like edge compute capabilities. And I want to look at also some kind of reserve on-prem capability for when my internet goes down and a meteorite or a road traffic accident takes out the fiber that connects my city with the next city. And unfortunately, a lot of these redundant paths will use the same fiber trunking to get between major points of the country. So we still need to be able to continue our service of patients when the internet is down. So we need to build that into our systems. And a lot of the cloud-based or remote hosted based systems, Epic Cerner, for example, are building that into their systems today. Mike, a few other points maybe?
Yeah, absolutely. Richard, can you hear me? I did have a little hiccup with my my sound.
Yeah,
Can you hear me?
you're coming in
Yeah.
5 by 5
Excellent.
now, Mike. Yeah.
So moving forward, I think bandwidth is really going to be a critical element. As we discuss some cloud-based initiatives, how we're really changing those concepts, going away from the data center business, moving forward with cloud-based initiatives is such an important aspect. When you come down to the smaller areas, like the rural communities, like the urban communities, connectivity is such an important aspect. So individuals are really going to need to reconsider their overall architectural process. What we did as an organization is we utilized some USAC funding, which basically was a federal telecommunication process that basically paid for around 60% of our overall infrastructure that we basically implemented. We implemented a new border gateway protocol, which really created a lot of redundancy throughout the actual process and gave us the bandwidth that we basically needed, because we've seen the mass adoption of remote working, telecommunicating, everything going wireless. Again, we're truly changing the way we are focusing on different initiatives, and bandwidth is really going to be one of those important factors out there that you need to reprioritize. Determine, do you have redundancy in place? Do you have true different ISPs that basically allow you to connect from one system to another efficiently? If one ISP goes down, do you still have that redundant in place moving forward? So again, diverse internet connections with our border gateway protocol allows us to have that 24/7 activity time and that strong bandwidth moving forward. So again, bandwidth is a critical element. Definitely add that to the overall organizational strategy and determined to come out with a strong, efficient way of making sure that you are connecting, even if an actual disaster does happen, as Richard has stated.
Yeah, and I think there's another point there as well that I didn't mention before. With so many of our employees working from home, so home internet access becomes, or home network access becomes critical as well, right? If we look at the majority of employees, they have a single, DSL line or cable line, if they're lucky, or a satellite line into their homes, and they're working off of that line. When that line goes down, they're no longer available. They're no longer able to help perhaps mitigate an outage at a hospital. So we need to look at putting in multiple redundant paths for critical staff and making sure that they've got adequate bandwidth so that they can instantiate a VPN tunnel back to a hospital for secure communication and other high bandwidth requirements. That may be a mixture of 5G and fiber to the home or whatever is available in a community. But the whole paradigm is shifting under COVID. And I think that the changes that we have seen of work from home and everyone ordering from Amazon versus going to the mall, and the fact that our corporate offices that cost thousands and thousands of dollars per square foot, there's been a reevaluation of the current work paradigm. And I can see that a large part of this, maybe not all of it, but a large part of this will persist. So, these are changing times, as Bob Dylan would have said.
Yes, indeed. And so if I can start to wrap us up here, we are already at the top of the hour. That was a very quick half hour. But I truly believe that what you guys are presenting today, COVID-19 really may have saved U.S. healthcare for numerous reasons. I think we're all learning a new norm of what life is going to be like, and hopefully we take the best out of what we're experiencing and be able to move that into everyday activities. And so I want to take a minute to thank Michael and Richard for your time and energy and putting into this great conversation for today. I also want to take a minute and thank you, all of our attendees, for joining today and taking some time out of your schedules to join us. From a quick view of all of our attendees, we had folks from all over Ohio. So thank you guys very much for joining today. Just a quick reminder, we have these, the virtual sessions every Thursday at this time. So please stay tuned and consider joining us for future presentations. With that, this concludes our session today. Thank you again, Michael and Richard, for presenting today.
Thank you.
Thank you, Alex.
All right, thanks everybody.
Thanks, Sam.